right. Thank you, everybody, for your patience. Obviously, it's taken a little bit longer. Sometimes, the stew needs to cook a little while before it's ready to eat, and I think that's what we've been doing here. I'm all full of food analogies this session. I don't know. No soup. At least it's stew now, Representative Zerwas. So
More soup?
it must be lunchtime. So, members, I'm going to, first of all, I'm going to move, or since Representative Atkins is before us with House File 588, and I'm going to move, for Representative Atkins, I'm going to move House File 588, that it be recommended to pass and re-referred to the Committee on Health and Human Services Finance. And then, members, I think everybody knows, it's no secret here that this has been a very contentious issue. It's been contentious not just this session, but for a very long time. And we have what we hope is kind of a negotiated, if not a solution, I don't want to overstate where we are, but the parties have been working very hard to come to some kind of place where we can move forward on this together, because this is an issue that we as a committee, as a health policy committee, have a lot of concerns here. Our primary concern is the health and well-being of patients, and there's, of course, some contention, some disagreement about how we can best assure the health and well-being of patients. But for us as a health committee, I think that we would all agree that that is our top concern here. And I'm going to, we have before us the 028 amendment, and before I move this, I'm going to incorporate a change on this amendment, and that would be on line 2.12. We're going to put a period after the word unit, and then strike the rest of that sentence and strike the sentence on 2.13. So I'm incorporating that change on the amendment that is before you. Did everybody understand that change?
Yep. Madam Chair, could you just repeat it one more time, please?
Certainly. The incorporation is on line 2.12, after the word unit, to put a period there, strike the rest of the sentence, and then strike the rest of the next sentence on 2.13 is stricken.
The whole sentence all the way down to 2.6?
No. Just line 2.12 after the word unit, and the line on 2.13. Does everybody have that? Okay, members, everyone has that change. Okay, so that's what I'm incorporating here. And so I'm going to move to adopt this amendment and put this delete everything amendment on the bill, and then we will discuss what we're doing here and before we vote on the bill as amended. So I would move the 028 amendment with the incorporated change. All those in favor of that amendment, please say aye.
Aye.
Opposed, no. The motion prevails. The amendment is adopted. So, members, before I go to Representative Atkins, I just want to have you take a look at what you've got before you, and this has to do with what's in this amendment is some language about doing some reporting on hospital staffing, and in addition having a study with the Department of Health to convene a work group to study the correlation between nurse staffing levels and patient outcomes. I think we're going to hear from Representative Atkins. I'm actually going to give him a chance to speak on his own bill here in a minute.
I think I'm doing really well so far, man.
This is what I learned as a young lawyer, Representative Atkins. When the judge is making your case, just shut up, right?
You'll notice I'm following well, Mr. Chair.
But so I think there's broad agreement that we need to do something in this area. There is a problem. And one of the things I think there's broad agreement on is that we do need to do some studying of the problem, because we have a hospital system where there is not just one, we have various kinds of hospitals, and those hospitals don't all function the same. This is not a one-size-fits-all situation. And part of what we need to know is to understand if we have a problem with patient safety, if we do, where that problem lies, and to help us get to some really good policy to address real issues that may exist. And so I think we want to study, and this study language is, I just want to say, this is in no way to be considered a final resolution of the issues that are before us in this bill. I want to say that again, neither side believes that this is a final resolution. But we're going in the right direction. We've got some reporting and some study of the further issues. And I think members of this committee understand that even reporting when it comes to hospitals is not a simple one-size-fits-all thing. There are a lot of issues around the way data is collected, the way it's reported, and I think what we want to do here, at least what I want to do, is get to a point where consumers, patients, can get a really clear view of which hospitals are getting good outcomes, which are not getting such good outcomes, and to the degree that staffing impacts those outcomes, they should be able to see what the staffing levels are and how they interplay with all of this. And this is going to take some much more detailed work and work by the parties to get to a place where we can really say, yes, this is the right method. So this amendment and the bill as it is now, I think, represents some really hard work on the part of both sides, for which I really want to commend everybody. And I also am going to request that everybody please, nobody is being let off the hook here today with this language, where we are absolutely requesting and expecting the parties to continue working on the details so that this session we can actually enact something that will move us forward to ensure that we have transparency and patient safety across the state. With that, Representative, maybe you'd like to address your bill. I think you did a lot of your talking last night. I'm trying to get you off the hook.
As former colleague Representative Yaros would say, it's a good bill, please vote green. But that's my best Croatian or Slavic impression. Thank you, Madam Chair. I know this has been a difficult issue for many years in this body, but there's some things that we uniformly agree on, and that is, and I wouldn't be carrying this bill if I didn't agree about that too, and that is, as you said, Madam Chair, it's about patient safety. And I think everybody involved wants to make sure that that occurs. Well, this may not, as you said, Madam Chair, be the final solution. It does, in fact, bring both parties considerably closer to each other. And reporting and studying and making sure that we're basing this on what the real facts are, I don't think anybody could argue with that either. And with that, I don't think there's anything further to be added to what the Chair said. I would appreciate support for this bill as amended. Madam Chair, I will turn it back to you unless members happen to have questions.
Okay, thank you, Representative Atkins. And I think we may have one testifier on the bill, and so I'm not sure who that's going to be, but would ask them to approach if they know who they are. And of course, we never prevent anybody from testifying on a bill if they so choose, but welcome to the committee.
Madam Chair, members of the committee, my name is Lawrence Massa. I'm the President and CEO of the Minnesota Hospital Association. We appreciate the opportunity to testify this morning. We also appreciate the author, the Minnesota Nurses Association, all of the people that have worked on this language for moving away from mandated staffing ratios. As you know, that's been our biggest concern with this bill from the beginning, and we continue to believe that moving staffing decisions away from the bedside based on the needs of actual patients being cared for is a dangerous precedent and bad policy. The compromise language is fairly new, as you would guess. We have talked about some reporting language with our members. This goes further than the discussion that we've had. So we certainly are open to continuing the discussion on transparency and reporting. As always, the devil is in the details. So we're going to need to vet this with our members and seek additional input. But we think this is a step in the right direction. You talked about earlier focusing on outcomes. I think the study is certainly something we can work with. We have testified many times that we achieve pretty good outcomes here in Minnesota hospitals when you look at national statistics, yet we have the varying degrees of opinion about how we're getting to that. So I think looking at outcomes will continue to be the right approach, and as we implement healthcare reform and try to bring costs under control, processes are going to evolve and change. So I think continuing to make sure there's a strong focus on outcomes in terms of how we measure things is a really good idea. So we can work with the amendment as presented, and we appreciate everyone's work in making that happen. Thank you.
Thank you, Mr. Massa. Representative Grunhagen.
I'll pass right now. Wait till the testify or any other testifiers.
Is there anybody else who wants to testify for or against this bill? All right, seeing none.
Well, that must be like here, right?
Representative Grunhagen.
All right. Just so we're basically reducing the bill down to a study. Is that the correct understanding? No. There's more than that.
Madam Chair, Representative Grunhagen.
Representative Atkins.
Briefly, no, it's not just a study, although the study is a critical component, and that's reflected in the Chair's amendment starting on lines 2.14.
Yep.
But there's also some reporting, and I'll let the language speak for itself, but most of it's contained in well, basically on page 2. Some core staffing plan disclosure or development and disclosure, and then on the website, starting in subdivision 3 there, the core staffing plan will be on the Minnesota Hospital Association's Minnesota Hospital Quality Report website with substantial changes to the core staffing plan updated within 30 days, and then also including on the website for each reporting hospital on a quarterly basis the actual direct patient care hours per patient and per unit.
Madam Chair.
Representative Grunhagen.
Yeah, I do have some comments, but I want to wait to see. I think there's some amendments coming, or I don't know if there are or not, but otherwise I've got some final questions when we're ready to vote on the final product.
Well, Representative Grunhagen, I know that some amendments have been drafted, but there has been quite a bit of negotiation between the parties here, and this is kind of and Representative Grunhagen, the amendments were to the original bill, I'm reminded. We've now put on this delete all. So those amendments really pretty much no longer apply.
Oh, okay.
And, of course, any member can offer an amendment, but I think the sides here are, I think what we're hearing is that people are reasonably comfortable with this and ready to move forward. Both sides. So Representative Atkins, of course, the bill came from the Minnesota Nurses Association. He is the author of that bill, so he's, I believe, speaking for that side. And then you just heard from the other side that they're reasonably comfortable with moving this forward. So,
okay. Thank you, Madam Chair.
Are there other questions, members? Okay. Seeing none, I think we're ready to actually vote on this issue. I think we should release confetti or something, Representative Atkins.
There'd be white smoke going up.
White smoke. There you go. All right, so I will renew my motion that House File 588, as amended, be recommended to pass and re-referred to the Committee on Health and Human Services Finance. All those in favor, please say aye.
Aye.
All opposed, no.
No.
The motion prevails and the bill is passed. Thank you. Thank you, members, and thank you to those in the room. And we are adjourned.